Good morning, students. In today's lecture, we would be discussing about the anatomy of the larynx. In this figure, you can see the various parts of the larynx shown from various views, different views. So, larynx in Latin, it means upper windpipe. It is an its function is the production of voice, or also known as phonation. It is part of the air passage and it acts as sphincter at the inlet of lower respiratory passages. So if you see in this figure, the lower respiratory passage, it consists of trachea, it consists of bronchioles, lungs. These all are the lower respiratory passages. So basically this larynx is an sphincter that is present at the inlet of this lower respiratory passage. Location of the larynx. Where is the larynx located? It is located in the anterior midline of neck, extending from the root of tongue to trachea. So जब हमने anatomy of tongue discuss की थी तो हमने वहाँ पे देखा था that the epiglottis, which is part of the larynx, one of the cartilages of the larynx, that epiglottis is attached to the posterior most part of the tongue with the help of glossoepiglottic folds. So उस level से, this is epiglottis and this part of the epiglottis is attached to the posterior most part of the tongue. So it extends from the root of tongue to the trachea. These rings that you can see are the rings of trachea, and larynx extends up to these rings, the trachea. In adult females and children, the location is slightly higher as compared to adult males. In adult males, the location of larynx, अगर हम vertebral level के according देखें तो in adult males, the larynx lies in front of 3rd to 6th cervical vertebra. These are the typical cervical vertebra, and against this vertebral level, the larynx lies in case of adult males. In case of children and adult females, it is at a little higher level. Size longer in males, 44 mm, as compared to females. In females, it is only 36 mm. The internal diameter is 3 mm for up to 3 years of age, and in adults, it is 12 mm. Pubertal growth is different in males and females. In males, the growth is rapid, and the larynx is visible on the outside as a prominent angle of thyroid cartilage, which is known as Adam's apple. And in females, the growth is negligible. ये जो differences हैं in the growth of larynx, इसके वजह से voice tone में, voice texture में भी differences होते हैं. So in case of an adult male at the pubertal age group, the voice is louder, low pitched. In females, the voice is high pitched. So this difference in the tone and texture of voice is because of the differences in the development of larynx in case of males and females. So in this figure you can see here, this is larynx with the cartilages. This is epiglottis, this is the thyroid cartilage of the larynx, this is the cricoid cartilage. On the inner side there is arytenoid cartilage. So the thyroid cartilage, that is this part, is the laryngeal prominence or the Adam's apple, and in case of males it is prominent and it could be seen as a prominence on the outside. And that's also the location of the larynx in the anterior part, in the midline of the neck. So the parts of the larynx consists of various cartilages connected with the help of joints, ligaments, membranes. There are muscles also which help in the movement of this larynx. And then there is a cavity which is lined by mucous membrane. This is the membrane. Similarly, there are ligaments, there are joints, muscles as well, and this is the internal, on the inner side, this is the cavity which is lined by mucous membrane. So there are different type of cartilages that come together, combine to form the larynx. So the important cartilages of the larynx are, unpaired cartilages are thyroid cartilage, cricoid cartilage, and epiglottis. The paired cartilages are arytenoid, corniculate, and cuneiform. So the first cartilage is the thyroid cartilage, and you can see in the figure next to this box, this largest cartilage is the thyroid cartilage in relation with the thyroid gland, and there are two laminae, there are two parts, right and left. These laminae are roughly quadrilateral in shape, obliquely placed relative to the midline. If you see these laminae, they are in relation to the midline, they are obliquely placed. If you see their direction, they are oblique in relation to the midline. There are two borders of the thyroid cartilage, the anterior border and the posterior border. So anterior border of the thyroid cartilage is this. This is the anterior border. In the upper part, the parts of the anterior border do not meet and they form a thyroid notch. So this depression that you see here is the thyroid notch, and this is anterior border. In the upper part, they do not meet, but in the lower part, they fuse together. The right and the left laminae, they fuse together and they form a median projection which is known as laryngeal prominence or Adam's apple. So the upper parts, these are the upper parts, they are not fused, they do not meet, and they form a thyroid notch. So the lower parts form the laryngeal prominence and the upper parts, they form the thyroid notch. Posterior border is free. This is the posterior border. This border is free. This is anterior border. This entire is the anterior border and this is the posterior border. Posterior border is free and it has two horns or two projections which are known as superior and inferior cornua. So this is superior cornua and this is the inferior cornua. Also it can be seen in this figure. This is anterior border with its upper part and the lower part, and these on the back side, these are the posterior borders, and they have two projections, two horns, superior and inferior. So the superior cornua is connected with the greater cornua of the hyoid bone. This is the hyoid bone. This is thyrohyoid membrane because it is between the thyroid cartilage and the hyoid bone. So it is referred to as thyrohyoid membrane. So you can see here, this is thyroid cartilage. This is the posterior border. This extension is the superior cornua of the thyroid cartilage and it is connected with the greater cornua. This is the greater cornua of the hyoid bone with the help of lateral thyrohyoid ligament. This portion, this ligament is the thyrohyoid ligament. And why lateral? Because this is the lateral side also. If this is the midline, this is the middle side, midline. This is both the sides that is, if this is midline, these two would be lateral. So if this is attached to the hyoid bone, the ligament attaching is the lateral thyrohyoid. Inferior side, that is the inferior cornua, is connected with the cricoid cartilage. So below the thyroid cartilage, in this figure you can see this is thyroid cartilage. Below the thyroid cartilage, this is the cricoid cartilage, and the inferior cornua is connected with this cricoid cartilage, and they form the cricothyroid joint. There is also one more structure which is conus elasticus. So the conus elasticus connects the inferior border of the thyroid cartilage. This is thyroid cartilage. This is the on the lower side you have the inferior border. So in the midline, it is connected to the cricoid cartilage with the help of this conus elasticus. On the outer surface of the thyroid cartilage, there are two oblique lines. This is the outer surface, and there are two oblique lines that extend from the superior thyroid tubercle to the inferior thyroid tubercle. There are two tubercles, superior side and inferior side. So the line extends from these tubercles, and it is behind the middle of inferior border. So if you see here, these are the oblique lines that we are talking about, and they lie behind the, this is inferior border, so they lie behind the middle of the inferior border. Again, in this figure also you can see the various parts of the thyroid cartilage, that is the cornua, the oblique line that extends from the superior tubercle to the inferior tubercle. Next is the cricoid cartilage. It is a ring-shaped cartilage, encircles the larynx below the thyroid cartilage. Foundation stone of the larynx, thicker and stronger than the thyroid cartilage. It is thick and strong than the thyroid cartilage. So this is the ring-shaped cartilage that encircles, surrounds the thyroid cartilage. Also in this figure, this is thyroid, this is cricoid. So cricoid is a ring, and this ring consists of two main parts. One is the arch. This portion is known as arch, and this portion is known as lamina. So the lamina projects upwards behind the thyroid cartilage. So if you see here in the figure, this is the lamina of the cricoid cartilage, and it is behind the thyroid cartilage, and it articulates superiorly with the arytenoid cartilage. If you can see in this figure, this is cricoid cartilage, this is arytenoid cartilage. This is the lamina portion of the cricoid cartilage, and it projects upwards behind the thyroid cartilage, and it articulates with the arytenoid cartilage. The inferior cornua of thyroid cartilage articulates with side of cricoid cartilage at junction of arch and lamina. We've already seen this. Inferior cornua articulates with the cricoid cartilage at the junction of the arch and the lamina. This would be the junction. So various facets are present. This is the site where the arytenoid cartilage articulates with the cricoid, and this is the site where the inferior cornua of the thyroid cartilage articulates with the cricoid cartilage. So that's all for today. The remaining cartilages and remaining anatomy about the larynx would be discussed in the next video. Thank you so much.